What's up, guys? Dr. Chris Park here, and today I want to talk a little bit about what doctors get wrong on Suboxone. And obviously, it's not all doctors. I'm kind of painting with a broad stroke here. I'm discussing the medical community at large, how they oftentimes do not understand using medications for treatment. And when I started treating addiction about 12 years ago or so, I encountered a lot of resistance from doctors that I really respected. And it wasn't bad. I mean, they it's kind of like they just thought, you'll learn better because you can't trust these patients. And there was this idea that you should never give any kind of controlled substance, something that has the potential for dependence and even abuse or addiction, to someone who's already struggling with addiction. And that makes sense, right? And on face value, what do they say? They say you're just substituting one thing for another. And again, if that's all you hear, it kind of makes sense. Unless you actually study the mechanism of action of the medication buprenorphine, and you start to see how it works. How does it bind to the receptors in the brain? How does it stop withdrawal? How does it help to curb cravings? When you start to understand like the biology of addiction, you see where medication treatment can help. And when I started out, we called it medication-assisted treatment, right? And I don't know what the new term is. People get so upset about terminology these days that I'm not sure what the politically correct wording is. But this idea that medication assistance is doing just that. It's assisting your recovery. And I've talked about this in other videos, that the medication itself is not the recovery, right? It's to help you with the recovery. So you're not struggling with withdrawals, like, you know what I mean? You're not struggling with these deep cravings. Now, if you can go cold turkey and get into a 12-step program or something similar, that's awesome, okay? If I can get patients with high blood pressure to exercise 30 minutes a day, to lose 10 or 15 pounds, to change their diet, they also don't need the blood pressure medicine, right? But if they can't do those things on their own, I'm going to use medication to assist them. It doesn't mean I'm going to stop trying to counsel them and try to guide them into healthier ways to live. But I'm also not going to just wash my hands of them and say, no, you're on your, you won't exercise every day. I'm not giving you medicine. Go have fun having a stroke in 20 years. No, that would not be the ethical thing to do. And in treating addiction, we have to take the patient and we have to decide, okay, what is the best route for you to get the recovery that you need. And that's why I say the medication is not the recovery, but the medication can help recovery. It can help. It's not for everybody, but it most definitely can help your recovery. And that's what a lot of these pharmacists and nurses and doctors don't understand. If they're not actually treating addiction, it's kind of lost on them, right? That there is a process that we're using to help guide people in their recovery. And then a lot of times what people say is, well, this person's been on this medicine for 10 years. Okay. Please show me, the evidence that people with addictions, that it's not a lifetime struggle. Please show me where someone with addiction should be able to be clean in 2 months and never struggle again. They can't do it. And I'm not saying that everybody has to be on medication assistance for 10 years, but some people need longer treatment, okay? The goal is to stay off of drugs, to stay clean, to live a good life where you're not having to lie to people, you're not having to hide things, you're not having to steal, you're constantly thinking about how you're going to go about getting your next fix. We want you in recovery where you're building relationships, where you're becoming a better person, where you're not like living in this cycle of guilt and shame. That's what we want. We want you living like a normal life, whatever normal is for you. I mean, and it doesn't mean you're not going to struggle and you're not going to suffer. And again, it doesn't mean that recovery should be easy. That's not the point of the medication. It's not to make it easier for you. And that gets on my nerves too when people comment that you're just, taking the easy way out. No, it's not easy. And if you've ever tried to get off Suboxone, it's not easy. So if you can do it, if you can go through recovery without medication assistance, good. There's other medicines out there that helps with acute withdrawal, right? That are not addictive. And that might be the best option for you, is to use those medications and just kind of stop things, right? But you need to do that in a plan with your doctor. And again, this video is not for you to try to do things on your own. I want you in conversations with your doctor, with your therapist, your counselor, your AA sponsor, whoever it is. Talk to them and kind of y'all come up with a plan. But definitely don't change any medicine or take anything without talking to your doctor. Do it the right way. Get into an actual recovery program, not some just clinic that's going to give you medicine. Get into a recovery program. So if you've got a clinic that's prescribing your meds, great. Now you need to do the rest. You need to work on the other things. You need to be putting in the work. And that, I think, is lacking in a lot of people, because people get on medication assistance and they feel normal. Like I said, now they can work their job. But they're not dealing with those inner demons. And those inner demons will find a way to make your life miserable, even if it's not through drugs. Okay? And there's a lot of you out there that are going to listen to this and it's going to hit home. So go talk to somebody. Talk to a priest. Talk to a counselor. Go to AA or NA or Celebrate Recovery or any of those good, group programs that have shown to be effective in helping people battle and defeat addiction. All right, guys? All right. I'm Dr. Chris Park, and drink some coffee. Today is Easter for my Western friends, and it's not Easter for my Eastern Orthodox friends. So if you're in the West, my Catholic and Protestant friends, happy Easter. If you're Eastern Orthodox, continue with Lent. All right, guys. Hope y'all have a great day. Peace.